While the United States is taking bold steps to protect moms and babies by pulling the novel modified RNA COVID-19 vaccine from the recommended schedule for healthy kids and pregnant women, Canada's still stuck in this safe and effective echo chamber and scientific dark ages. So let's dig in. Here's a clip of U.S. Secretary Robert F. Kennedy Jr. announcing this pivotal change. The U.S. Department of Health and Human Services says it's common sense, good science, pointing to a lack of clinical data supporting endless boosters in these vaccines for healthy groups.
Hi, everybody. I'm Robert F. Kennedy Jr., your HHS Secretary, and I'm here today with NIH Director Dr. Jay Bhattacharya and FDA Commissioner Dr. Marty Makary. I couldn't be more pleased to announce that as of today, the COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule. Last year, the Biden administration urged healthy children to get yet another COVID shot despite the lack of any clinical data to support the repeat booster strategy in children.
That ends today. It's common sense and it's good science.
There's no evidence healthy kids need it today, and most countries have stopped recommending it for children.
We're now one step closer to realizing President Trump's promise to make America healthy again.
But up here in Canada, well, the Society of Obstetricians and Gynecologists is doubling down, saying the COVID vaccine is strongly recommended during pregnancy. They claim it helps lower the chances of severe complications like preterm birth and death. And they even go on to say, in an age of growing misinformation and disinformation, the society strongly urges that vaccine decisions, including during pregnancy, be guided by evidence-based science and clinical expertise. That sounds good, right? Except they're leaving out some glaring details. For instance, neither Pfizer nor Moderna established safety for pregnant or breastfeeding women. Randomized controlled trials, which are the gold standard for safety, excluded pregnant moms entirely. And when Pfizer's data showing the pregnant women that somehow made it into their clinical trial was finally released after a court order, the stats were horrifying. Dr. Pierre Corey out of the U.S. analyzed Pfizer's trial data on pregnant women. Out of 32 reported pregnancy outcomes, there were 23 spontaneous abortions, 2 with intrauterine death, 2 premature births with neonatal death, and 1 spontaneous abortion with neonatal death. That's an 87.5% fetal or neonatal mortality rate, and it's broken down and clearly detailed in Dr. Davidson's COVID report out of Alberta, asking, can anyone honestly say that this is safe? But it gets worse. A new study by Karaman et al. Found that mRNA vaccines caused a 60% loss of primordial follicles in rats. That's the non-renewable foundation of female fertility that compromises their ovarian health. We're talking plummeting ovarian reserve, early menopause, and potential infertility. Human data already shows vaccinated women reporting menstrual disruptions and abnormalities. So are we in a silent fertility crisis that's only getting worse? While Canadian gynecologists parrot the safe and effective narrative, ignoring the alarming data and lack of informed consent. The Canadian Citizens Care Alliance, formerly called the Canadian COVID Care Alliance, or CCCA, has been sounding this alarm for years. They point out that global pharma, shielded by liability protection, is pushing under-tested maternal vaccines to extend profit margins at the expense of our babies. Health Canada knows about Pfizer's data. They know about the risks of biodistribution, modified RNA accumulation in organs, and the potential for catastrophic ovarian damage. Yet, they're still recommending this vaccine to pregnant women, ignoring the lack of long-term safety data and dismissing international trends. Most countries have stopped recommending this for healthy pregnant women. Why is the science different here in Canada? Being a pregnant woman in Canada right now means you're not getting the full picture. You're not told about the risks, the lack of data, or the international shifts. This isn't just a policy failure, it's a failure of duty. But if you remember Sean Hartman, the 17-year-old who died a month after his Pfizer shot, well, an Ontario judge ruled that the state had no duty of care to those harmed by pandemic measures like COVID-19 vaccine mandates. So who's really looking out for us? The US is prioritizing moms and babies with science and common sense. In Canada, we're stuck in a bureaucratic quagmire where political agendas trump evidence. It's time for transparency and time for informed consent because your health and our future depends on it. For Rebel News, I'm Tamara Ugolini. I'll be following up on this report with some experts like virologist Byron Bridle. So if you'd like to stay more and support my work, please do so at nomoreshots.ca. That's nomoreshots.ca.